In this presentation, I'm going to outline the antibiotic resistance in Vibrio vulnificus, hereafter VV. VV is found in estuaries, gram-negative bacteria. It was called a lactose-positive Vibrio when it was first identified because it was fermented in lactose. VV is opportunistic pathogen, and immunocompromised humans are more vulnerable to the infections. VV causes skin lesions, cellulitis, and septicemia, a blood poisoning by bacteria that can escalate really quickly to septic shock, which is a leading cause of death for Vibrio vulnificus infection. When the bacteria multiply by cloning, they can have a mutation in their DNA. And that mutant bacteria then clones itself. And if these bacteria are then present in the antibiotic pool, say for VV in estuaries, where that can be a lot of antibiotic residual thrown in as waste. Then the selective pressure favors the ones that can withstand antimicrobial effects. So in the end, only resistant bacteria survive and thrive. VV is incompetent by itself, so they cannot take up a free DNA and integrate in their chromosome unless it is Tian-Tian-induced transformation. Then they can take free DNA from the environment and they can successfully integrate in their chromosome. How humans can get microbes, that is in estuaries. In VV's case, they live on oysters, so eating raw or undercooked oysters or just coming to contact with the water where VV is. That way human can get infected. The cases of where humans got skin lesions or cellulitis was just by coming to contact with the water that a Vibrio vulnificus was found to be in. These were the blood samples from patients admitted in 5 different hospitals in Taiwan. Since all where's my cursor? Oh, there. Third generation of cephalosporins were effective, and also trimethoprim sulfomethoxazole was also 100% effective against Vibrio vulnificus. So these antibiotics were recommended for the treatment. In 1970s, tetracycline was also 100% effective. Then back then it was the preferred treatment over cephalothin. But a decade later, it is declining in its efficacy. Now, some strands are resistant to tetracycline, that only 71% of Vibrio vulnificus are susceptible. In Vibrio vulnificus, the infections they cause are very deadly. People can actually die within 48 hours of hospitalization due to septic shock. The septemia that rapidly escalates to sepsis. And within 24 hours, they can develop cellulitis, skin lesions. But these patients were initially admitted to hospital for chills, fever, or either pneumonia. The patient who had pneumonia went home against the doctor's advice, and I think he did not survive. It is not funny, but this is the study done in USA, Chesapeake Bay Area. Third generation of cephalosporins are declining in its efficacy. But tetracycline at Chesapeake Bay Area is 100% effective. Tetracycline is 100% effective to treat Vibrio vulnificus that come from Chesapeake Bay Area. These are water samples, so the tetracycline was recommended to use as a treatment. And around the Chesapeake Bay area is agriculture site and poultry feeding, and it has been a long tradition to use antibiotics on livestock as a preventative measure. So that could be one of the reasons that these other antibiotics are somewhat ineffective on Vibrio vulnificus strands, because VV that are in Chesapeake Bay Area might have developed resistance over time due to coming in contact with antibiotic residues from the poultry feeding sites or pesticides from agricultural side, since bacteria can express genes to defend themselves when they encounter harsh environment that they're not used to. And VV is very adaptable. Since using antibiotics as a treatment option has risk for resistance, thus drug inefficacy, later I think SNAP, structurally nano-engineered antimicrobial peptide polymers, this was synthesized by Lam and her group in Melbourne, Australia. So I think this SNAP could be a way to cap the growing antibiotic resistant bacteria, because one, it effectively kills multi-drug resistant bacteria, and there is no threat of resistance in the future, and it also has high therapeutic indices. Then colistin, which is now brought back on the market to treat infections, treat multi-drug resistant bacterial infection. When first colistin was brought into the market, shortly after it was taken out of the market because of its lethal side effects, and now it's back on the market again to treat multi-drug resistant bacterial infection, because other antibiotics that were not lethal as colistin have a decline in its effectiveness. So knowing the history of antibiotics and how they can become ineffective due to bacteria evolving to become able to counter the effects of antibiotics, I think SNAP could probably be the treatment we're looking for.